name's Katie, and today I would like to talk to you about the pelvic floor muscles. These muscles are interesting to me because after I had my son, I was having some dysfunction, and I didn't know what I should do about it so that I didn't have urinary incontinence during my work activities. Did you know that 1 in 3 women have urinary incontinence? The average person, the average pregnant person feels like, every pregnant person has urinary incontinence. And that's just a consequence of having children, but it doesn't have to be. We can do something about this. Today we'll talk about the pelvic floor, understand the role of the pelvic floor in bladder control, discover your core from the inside out, learn more on how to enhance pelvic floor muscle function, and incorporate pelvic floor muscles into daily activities. These pictures here are the pelvic floor. Don't memorize it. It's not that important. That's my job. What it's to show you is that it is a pretty complex area of the body. They are muscles. So like any other muscles in the body, they can be strengthened, they can be stretched, and they can be trained to increase their capacity for function. Know your inner core. So our inner core is like a bottle or a can. The top part of the can is the diaphragm. The bottom part is the muscles of the pelvic floor. And all the way around is your transverse abdominis. So that is supposed to keep you stable and upright while you're doing everything that you need to do in life. It also holds in all your organs. If something is going wrong with that can, urine is coming out without you expecting, sometimes even we're getting prolapse. The organs are coming out when we don't want them to. So why are these muscles important? Why are these pelvic floor muscles worth talking about? Well, they support the abdominal organs by holding things up. They're important to achieve appreciation for sexual intercourse, and they have a role in bladder and bowel control. Without them, your bladder and bowel would empty all by itself, and we need them for stability. When things go wrong, the pelvic floor is too tight. Muscles have too much tension in them, and they are not able to contract or relax at a normal rate. The pelvic floor is too loose. Muscles lack tension. They're too flexible. They cannot contract or are too weak. If some muscles are too loose and weak, other muscles will often overcompensate. Some symptoms of the pelvic floor muscle tension include constipation, painful intercourse, pelvic pain, inability to empty your bladder completely, or painful urination. If you experience any of these symptoms, those are good arguments to come and see a pelvic floor physical therapist. And you probably shouldn't just do any strengthening program without some guidance on what exercises could help make this better. Some symptoms of pelvic floor weakness include urinary incontinence, urinary urgency, frequency, stool and gas incontinence, pelvic organ prolapse, sexual dysfunction, and pelvic girdle pain. What are the different types of incontinence? What is urinary incontinence too? Any involuntary leakage of urine that is social or hygienic problem is incontinence. 1 in 3 women have urinary incontinence. Typically it affects women between 15 and 64. Only 25% of these women seek help. But if we break that down and look at the age ranges a little more closely, it's mostly the older women that are seeking help. We don't have to live with this. Seek help earlier, we can fix it, and you don't have to keep living with it. Incontinence. Stress incontinence is involuntary leakage of urine from an increased stress. So maybe a cough or a sneeze or jumping. This is pregnant women who feel like, everyone leaks a little. Nope, it's just that baby putting increased stress on a weak pelvic floor. We can fix that. Urge incontinence is when you get that sudden urge to find the bathroom, maybe when you're putting the key in the lock as you're just getting home, you instantly get that feeling like you need to find the bathroom fast. You can have a mixed incontinence, where you have some urge and some stress-related incontinence. Pelvic floor weakness can be caused by pregnancy, trauma to the pelvis, maybe a car accident or a fall, lack of pelvic floor or core exercises in your daily routine, abdominal or gynecological surgeries, bearing down or straining. Maybe you have a chronic cough or chronic constipation, so you're always putting increased pressure through that pelvic floor, and it's over time it just has to give. Obesity and menopause. So, how to exercise these pelvic floor muscles? Heard of the Kegel? 40% of women are not doing Kegel exercises correctly. It's not surprising. How did you learn about how to do a Kegel? You read it in a magazine, or someone handed you a pamphlet on how you should do them. Most 40% of people would benefit from some more in-depth feedback. So maybe a physical therapy visit, or maybe you can visit with your doctor or your medical provider, and they can give you some feedback and ensure that you're doing them correctly. Other ideas? Use a mirror. See if you can see those pelvic floor muscles move. If my hand is your pelvic floor muscles as you're looking between your legs, when you do a contraction, you should see them pull up and in. When you relax, they should go back to neutral, and when you elongate them, they should come out at you a little bit. Or use a self-evaluation. The stop urine test, I don't love it. It can increase your risk for urinary tract infections, and if you're using it too frequently, it's going to affect your body's natural way of eliminating urine. We don't want to do that. It's truly just a test. Use it sparingly. How to find your pelvic floor. Common mistakes of doing Kegel exercises: you're tightening your butt, you're tightening your thigh, you're holding your breath, or you're sucking in your belly. That's not the right exercise. If you're trying really hard, you're probably trying too hard and you're not getting the muscles that we're wanting. But it's not just about tightening them. That's why telling someone, just do some Kegels and it'll fix their pelvic pain or fix their incontinence, that's not enough. We need to do more. We need to be able to contract, relax, and elongate those muscles. They need to go through their entire range of motion. So, someone who has some core weakness and their pelvic floor muscles are tight and they're going around their world with tight pelvic floor muscles because their core is so weak, they're getting stability through those pelvic floor. Then they go and have a cough. Those muscles are already contracted. They can't contract further to try to prevent loss of urine. So you have loss of urine. By strengthening our core and focusing on relaxation of those pelvic floor muscles, we can eliminate that urinary incontinence. Taking your Kegel to the next level. When activating your pelvic floor muscles, make sure you can feel yourself tighten, relax, and elongate. When elongating your pelvic floor, don't strain. Pretend your pelvic floor is an elevator. If your pelvic floor is at rest on the ground level, go up to the next level, that's a contraction. Go back down to the ground floor, that's relaxing, and then elongate. Go down to the basement. Coordinating your pelvic floor with your inner core. Now that you found your pelvic floor, here comes the tricky part. Those muscles aren't supposed to work just when you think about it. They're supposed to work naturally when you need them to in a brief second, like when you get a cough. They need to kick in to prevent that loss of urine. If you're having difficulty trying to relax your pelvic floor, there's multiple things that we can try with physical therapy to help you with this. But one little tip, it's related to your breathing. So put on some relaxing music, do some deep breathing with big belly breaths. When you inhale, your pelvic floor should relax. When you exhale, it should slightly contract. You should be using your pelvic floor throughout the day. When you're lifting, going from sit to stand, doing exercises, coughing and sneezing. If you think about it, contract your pelvic floor and then complete these exercises. That's called the knack. But we shouldn't have to think about it. There are 45 muscles that attach to the pelvis. The pelvic floor muscles just make up a small percentage of these. We need to address all the other muscles that connect to the pelvis and eliminate any asymmetries and any imbalances. It's important to strengthen and stretch the other muscles surrounding the pelvis too. If you would like more information or feel that this is an area where you could use a little bit of help, you can find some information online at the National Association for Continence or Rehab Visions. This presentation today was made possible by the National Association for Continence and their granting sponsor, Astellas. You can contact me at Rehab Visions at 701-483-9400 and find some information online at dickinson.rehabvisions.com. Thanks.